Okay, so I'll hand it over to Kirsten.
All right, well, thank you, Marcia. Is everyone able to view my screen?
Yes.
All right, just want to be sure. Well, thank you for, I'm honored to have the opportunity to present CleanAire NC with the Durham Environmental Coalition. Miss Benita Green actually pulled me in this coalition, so thank you for pulling me in so I have the opportunity to connect with other great leaders in the Durham area as it relates to environmental health, environmental justice. So without further ado, CleanAire NC, we are a statewide nonprofit. Our mission is we advocate for the health of all North Carolinians by pursuing equitable and collaborative solutions that address climate change and air pollution. So within CleanAire NC, we do have 5 programs. Our CleanAire Advocacy Program is our policy arm, so to speak. We do understand that for long-term sustainable changes, policy is key for systemic changes specifically. So that's our advocacy side. CleanAire NC Health, which is what I'm going to go more in depth about, is our initiative looking at ways in which we can educate actual health professionals, clinicians, and we're inclusive. It doesn't have to be necessarily clinicians. It can be public health professionals, social workers, anyone within the space that is serving in the community and is looking to address health disparities. We provide environmental education, so as trusted gatekeepers, it can improve that patient-client dynamic as well as improve the awareness and education around the impacts of health, air pollution, and climate change. Then we have our citizen science program, which is essentially meeting community members where they're at. When we speak about what are ways in which we can advance change, I think most of us are privy to when it comes to legislators or decision makers, they want to see data. Everything is data driven, data. So how can we collect the data? So within our citizen science program, we actually, based upon community members, we do focus on environmental justice communities specifically that are disproportionately impacted by air pollution. We equip them with actual air monitors. So a purple air monitor, for an example, so they can actually collect data around particulate matter pollution, PM 2.5. And from the collection of data, we help support them, whether it's generating a report that can be proposed to county commissioners. We equipped the communities that are disproportionately impacted with air monitoring tool and resources so they can be part of the change that they're advocating within their respective communities. And that goes hand in hand with our environmental justice program, which I kind of already spoke to. So our focus is we know that when you are working with communities that are disproportionately impacted by air pollution, the changes that we're advocating for actually benefits all. But specifically, it's only right that communities that are most impacted are involved directly, not as just, we're only going to come and speak to you when, there's something on the agenda. We need to be involved as much as possible, be intentional with our actions. So that's our program with environmental justice. And then last but not least, we have our education program. For a total of 5. And our education program has had a variety of different focus areas, but in recent years, it's been focused on climate change specifically. So we just actually, early last month, we just had our annual NC Brief conference. The themes within the last few years have been focused on equity or health equity in the climate crisis. It was at Catawba College in Salisbury, and there was more than 175 attendees. It was a hybrid event, so individuals had the option to decide whether they want to attend in person or virtual. But the key takeaways anytime that we have this annual Brief conference is we want to bring together diverse stakeholders to not just, of course, address or increase awareness around the issues, but we want to come up with collaborative solutions to advance the changes in these communities. So it's intergenerational movement, again, to advance climate health and equity. And then our keynote speakers this year, Richard Moore and Tacoby Wilson, are both nationally recognized environmental justice leaders. For anyone who was interested in kind of seeing what a conference may look like, or any of the speakers, you can actually visit the CleanAire NC website. This is a hyperlink. I can also send it as an email, so you guys could go to our webpage if you want to view any of those presentations. So with the health program, the initiative within the health program is it's MAHA, or in other words, Medical Advocates for Healthy Air. Going back to what I was mentioning in the prior slide, is our goal within the health program, or Medical Advocates for Healthy Air, is actually training health professionals. So providing the education piece, because we do recognize historically a lot of medical school curriculum does not place an emphasis on the role that environmental health has on health disparities. It's often, and even if it is mentioned, it's at a very subtle level. So we address that gap. And by providing that education, physicians, oftentimes going back to advocacy piece, because doctors, nurses, healthcare professionals are viewed as trusted voices, they're key to us actually advocating for policy changes. So in this picture, you actually see one of our MAHA advisory board members, Dr. Bob Parr, speaking at the North Carolina General Assembly. And then last but not least, we have our healthcare sustainability. So when it comes to construction of healthcare, hospitals, et cetera, the construction emits a lot of diesel emissions. So what we do advocate for, and we partner up with hospitals and some universities in North Carolina, is that as there's construction ongoing, that the actual construction vehicles that are utilized are either low emission vehicles to help mitigate or minimize the air pollution that is emitted. And of course, that can benefit not just the larger community if we're reducing or minimizing emissions. If we can't completely eliminate it, it also improves the actual occupational health of individuals who are engaged in construction work as well. So air pollution, for those who are previewing in the space, climate change and air pollution is actually a greatest threat to public health. It's tricky because with air, air is invisible. When it comes to pollution, we can see smog, but a lot of the, particulate matter, PM 2.5, which I referenced, you can't see it. So how do you fight or combat against something that you can't see? Nonetheless, try to convince individuals that even though we can't see it, it is a threat to all of our health. But we do also recognize that, going back to disproportionate impact, there are individuals who are more vulnerable than others, and it does impact health throughout the entire life course. So even looking at, the image, let's say a woman is planning to, start a family, we do understand. So even before a pregnancy happens, if I'm an individual who lives in an area with significant, air pollution, and it could be a cumulative impact of not just air pollution, water pollution, soil pollution. I live in an area that, is intersected by, whether it's the interstate or highways, or there's just heavy traffic from larger, mid-sized to large vehicles. I'm breathing these pollutants. So nonetheless, if one becomes pregnant, there actually can be an increased risk as a result of exposure to air pollution, increased risk for low birth weight. That same child who may be born to, the mother living in the same pollutant area, there's an increased risk for asthma. Children, because their bodies are still developing, it actually can slow the development of their lungs and actually, have an impact on other developmental or have a detrimental impact on Other developmental issues, we do know in regards of asthma that can lead to more wheezing and coughing, and then the start of atherosclerosis, or actually heart disease. And then in adults, that same child ages and becomes adult again, whether they were clinically diagnosed with asthma or not. You later on in life, a person may experience asthma symptoms or actually be diagnosed with asthma. We mentioned regards of the start of heart disease. It can obviously advance coronary heart disease, increased risk for stroke, cancer, COPD, as well as diabetes. And then as we age and become seniors, naturally, the lung function declines as we age, but again, living in an area where there's significant levels of air pollution can actually accelerate the decline of lung function. And even amongst individuals who've never smoked a cigarette a day in their life, or may not have exposure to secondhand smoke, there is an increased risk for lung cancer, diabetes, dementia, and there's also a mental health component as well. It can increase risk for dementia. So how are we measuring air pollutants? So going back to equipping community members, our citizen science, with air monitors. Air monitors are able to gauge ozone or particulate matter, but in this case, I'm focusing on particulate matter, PM2.5, because that's where our purple air monitors can gauge. But if you go onto airnow.gov, you'll see this chart, and it will let you know what the air quality index is in your area. And the tricky thing about this air quality index, there's a lack of air monitoring in these EJ communities, or environmental justice communities. So even if you have, the weather app on your phone, and your weather app on your phone often will tell you what the air quality is in the area, that may not be an accurate reading because it's not hyperlocal. So it doesn't benefit us if the federal air monitoring is showing you the air quality in an area that's 25, 50 miles away from you, because we know that, or some of us are aware that air quality can vary significantly even within a few miles, nonetheless 25 or 50 miles, which is why we want to provide individuals with air monitors so we can get a more accurate reading of the air quality. So if we're in the 0 to 50 range, we know it's a great day for individuals to be outside. If you are a person who has an underlying medical condition, whether that's asthma or COPD, or even going back to the prior slide, pregnant women, etc. If you know that you may be more sensitive to particle pollution, you may want to, decide whether or not, or limit your activity levels outdoor for a particular day. So again, we want people to be able to make informed decisions that is best for them. And then of course, as we move down the chart and we get into the orange, again, there is of course an increasing risk. So again, we advocate for individuals to kind of, decide how active they want to engage in outdoor activity. And if they are outdoors, let's say for an example, your work requires you to be outside, so you don't really have a choice. So that's important. It's easy to tell people, well, limit your outdoor activities, but if you are engaged in outdoor work, what can you do? So then we just say, well, try to, as much as within reason, less intense activities, take more breaks, etc. If you are a person who has asthma, such as myself, have a conversation with your healthcare team to decide, because prevention or being proactive is key. Have an action plan in place. So anytime that there may be an increase of particulate air pollution, let's say a wildfire, for an example, you're not just solely being reactive. You actually have a plan in place to help mitigate those factors. And then of course, if you're a person who has heart disease, and you're outside and you experience any symptoms such as palpitation, shortness of breath, that can be a sign of a serious issue. And again, you want to speak with your healthcare provider. And then of course, once we get into the red and anything below red into the dark maroon, regardless of your health status, you can be the healthiest individual with no health condition, no history of any complications. once we're in the red, it's dangerous. It's a threat to everybody. And at that point in time, no one would really need to be outdoors, and it requires collective action to mitigate factors. So that brings us to our citizen science monitoring program. So that combines our health program, our citizen science program, and our environmental justice program to address health inequities caused by air pollution and environmental justice communities. So the example I'm going to show is that CleanAire NC, we're statewide. So we're split between RTP, which is I'm in the Durham area, and then other half of my team is in Charlotte. So in 2016, CleanAire NC actually started partnering with historic West End leaders, or historic West End air keepers who you see in this picture. In 2016, because right around 2016 is when purple air monitors, which actually measure particulate matter 2.5, became more available. And it's actually, compared to air monitors can be very expensive, but purple air monitors is actually a very low cost, efficient way to measure PM 2.5. So we did provide our air keepers who you see in these pictures. They actually represent 3 different neighborhoods within the historic West End. We equipped them all with air monitors, or purple air monitors, so they could track their particulate matter in their respective neighborhoods within the historic West End. With background in regards of, well, for those who are not familiar with historic West End or Charlotte, redlining is a impact of systemic racism. Back in the 1930s, homeowner association actually came up with the concept of basically creating these maps, identifying, which communities are best and which communities on the other ends are the most hazardous, is actually the word they use. So if you're in the red, it was literally identified as a hazardous community. So if we look at, this is actually a redlining map of the Charlotte area back in 1935. You see, if anything is in the red that was identified that it's a hazardous community, hazardous could be it's either in poor location, regards of, if you want to think about like flooding, things of the nature, lack of resources, lack of opportunity. It was highlighted in the red, whereas in the green, that is the best neighborhoods according to the map that they were using. So again, you're thinking about more high income, more opportunities, greater access to resources. So if this was in 1935 and it's systemic racism, you can't be surprised, fast forward to when Mecklenburg County did their community health assessment 2012, 2016, the same areas that were redlined and kind of created this crescent are the areas that have less or poorer outcomes when it comes to social determinants of health, where you work, where you play. So we're looking at poverty in these same areas that were intentionally redlined, not just poverty, but even poor health outcomes as well. So it's an economic segregation, it's an environmental segregation. And again, it exacerbates all those underlying health conditions that I showed in the prior slide. There's an increased risk as a result of these practices that still impact us here in 2022. So back in, this is 2019 or so. So remember I mentioned that our air keepers, our citizen science, we gave 3 of our community leaders within the historic West End air monitors. So from the collection of the data that they were actually doing in that time frame, they decided to put together a report to propose to the Mecklenburg County Commission. So you see Ron Ross, who's one of our airkeeper leaders, actually speaking at the County Commission board, sharing with legislators, decision makers, policy makers, the results of their citizen science, monitoring. And it wasn't planned. When he was sharing the actual report, he just asked, I would like to see in our neighborhoods, we need a federal air monitor. And it just so happened that there was a federal air monitor available within the EPA at that time. So from actually putting together that report, ultimately, the Historic Weston actually got an air monitor from the EPA so they can further track the air quality in their respective neighborhood. So monitoring is so important because that can lead to policy changes. So in addition to increased air monitoring, local air monitors, whereas federal air monitoring, ways that we're looking at mitigating air pollution is tree planting. We do understand you can't plant your way out of air pollution. However, tree planting can reduce pollution, have many health benefits as well. So there's a lot of tree planting ongoing within Historic Weston. There is an emphasis upon green infrastructure. So installing green roofs, green walls to help filter out pollution, as well as cool the area, because heat waves or heat islands, that also has a health component as well. And then there's a lot of advocacy work being done around electric vehicles or hybrid vehicles, as well as installing charging stations and supporting healthier pedestrian activities, whether it's walking, biking, and clean transit throughout the Historic Weston. Again, education, it's an ongoing thing. We want to continue to educate individuals about the impacts of air pollution, even as more research comes out. And other accomplishments is the installation of a pole vault, which was actually the first of its kind in the country. It's a charging station that was able to utilize existing electricity sources. So you see, this is a telephone pole that actually, it didn't require them to dig up or do any extensive labor. So individuals who do have hybrids or EVs, they can charge their car, and this is within the Historic Weston. So while individuals wait to charge their car, they can frequent, local businesses, restaurants, etc. within Historic Weston. So there's economic benefit as well. And the goal is we want to see more charging stations installed soon. We're in works with Wells Fargo's to actually have a clean air garden, going back to, again, the importance of planting trees and other plants that can help mitigate air pollution. And then this July and later on in September, we have two series. We have the Healthy Air Education series, which will be Historic Weston AHA leaders, providing education to, it's not exclusive to Historic Weston. If you're a person who just wants to learn, everybody is invited. It will be virtual or hybrid as well, because we do understand that, during this time, some people may or may not be comfortable with meeting in person, and we want to respect that. But that will be in September, and then our Clean Air Advocacy training will actually begin in July, and that is educating community members around policy as it relates to air pollution and climate change. So with policy being the last thing, currently we are stakeholders in the development of NC's carbon plan, which was just released this past week. We're also stakeholders in NC Clean Transportation Plan, which is, there's work groups currently meeting. I just attended one of, it will be a total of 6 work groups meeting over the summer to discuss what are ways in which EJ communities are prioritized and health equity is prioritized in the development of these plans. And then the Department of Health and Human Services, they're actually working on an environmental health data dashboard. So we're also in conversations with them of what this health data dashboard can capture, so individuals can make informed decisions that benefit them, as well as advance policy. So that is all I have for you guys today. If you have any questions, I'll be glad to answer it to the best of my ability. I may not have all the answers, but I'll do my best, or I can redirect you to individuals who may have the answer. And other than that, I thank you all for the time to allow me to share what we're doing.